I'm Dr. A GP based in the UK, and if you have episodes of vomiting with periods of being normal and then vomiting, you could have what this patient has, which is cyclical vomiting syndrome. This is another under-recognised condition where we don't really know the cause. Now, it can affect children or adults. Now, in this syndrome, the patient has intense episodes of vomiting that can last a few days, and they may vomit 6, 7, 8 times or more without a cause. And then they generally have periods of where they're well. However, the vomiting starts again maybe a month or so later. There's 4 phases to this syndrome. The first phase is the prodrome phase, where you feel like you're going to vomit, you might be sweaty and look pale. The second phase is the vomiting phase, where you can vomit 5 to 6 or even up to 10 times a day. You feel unwell, you have headaches, you may have a temperature, and you may also have migraines. This phase can last up to a week. Third phase is the recovery phase, where the vomiting stops and your other symptoms begin to improve. Fourth phase is the well phase, where you have no symptoms at all and you're otherwise well. This is the diagnostic criteria in adults. Now, you may also need blood tests, scans, and endoscopies to make sure there's no underlying cause for your symptoms. Now, like I mentioned in the beginning of the video, we don't know the cause, but there can be triggers, most commonly things like emotional stress, lifestyle stress, excessive exercise, lack of sleep, and overeating or undereating. Syndrome generally lasts a few years, but worst case scenario, it can last for decades. Now, in the short term, when you're having attacks, treatment is generally around symptomatic relief, and it includes medication. However, if the vomiting is severe and causes dehydration, you need admittance into hospital to get IV therapy to make you feel better.